Okay, thank you very much for staying tuned. CRF Radio, CRF TV, coming to you live from Adenta Frafraha, CRF Smart Clinic Building. Hayani transmitting free. So just as I promised you, Doctor is right here in the building with me, and within the Jeffrey, I'll be crossing over to Doctor's place. You're betting Komwa after your pomodin home. A pomodin one semi a debia. And says any pebia to turn us a crack. It sounds as I do an ebay or there, a pomodin. For walk up here and right shame for phobia coins and sembasa. We also footballers if they weren't having strength and commit Makojina Park so ababo and patch or derby. And Adia Bakwayana a BTA FA Pomudin who a yen children in Diana yen yentia. So I'm very glad to have Doc in the house today. Doc, I can say a boy in Sama Mananja. I just hear Fred Ghana phone in I saw a post on YouTube today and I was very happy. There was a particular lady being and she was like, God bless you for the care that you have for humanity. I don't know whether you saw that comment on YouTube this afternoon when the gospel was being played. There was a lady who made a comment, and I think about few comments also came in. But our highest one thing was Johnny, I CRF Radio, I CRF TV. Your friend me, Nana Kwame, if you wait my friend me DJ Fresh. Me patch your mene Dr. Danso, any of you opening Kessia or no ended a CRF Smart Clinic, a Jumaku, Kessia no ano. Sabre me work ni dog, Nama Mano, Aquaba, Abba, Afidi, Kessia, so opening Kessia, Memo Acho, and Moquaba, Abba CRF. But also a pomudi, yeah, that over there, and I say, Namiado means me who ye papa, I feel I'm a feel.
The Juman doors, we are doctor,
sure.
Yeah, now, Mrs. The way I'm passionate about making sure we'll be okay. Yeah, now, times in a good consultation.
No, great. That's great. It's very great to have you. And Pachosa, I feel one journey. I CRF TV. We are live on CRF Radio. Maybe I will be here. You can do the monitoring and also join us live. But we are transmitting live from YouTube at CRF Television. We are also live on Modern Ghana at CRF Radio. But Modern join a conversation. My main called dog. I mean, my very first question. Dog, abribiano, ayana yaka apomuden, ene ayaresa, ene yarea. Ayana si yenshada and these 3 terms nasi. Yesi obi wa apomuden, yesi obi yare, ene ayaresa. Eba chose kasi obi wa apomuden a na sa nipa no ne hwan.
Yo me dase. Me chama yeti fo nyina.
Ene omo share live on television.
Me adom ti na sesi no CRF yetimi abedru baby ayewi see how wetimi atie radio and live on
TV
ti anyway there me di mo eba bedin kita on kakra me ka twi microphone
fra yes sure
because you were fra
but of fra my
say obisa me say apomodin no ye den ya apomodin no say nipa wona asomdwe say weda yi na wasori anopa na unti peni bia wo obebia ana say obeti peni kra enye pena eye ne ede obeto ayaresabia.
Okay,
so apomodin eye obi a wona asomdwe peace of mind, good health, so weda yi wedidi yi benu musu yi on time.
Okay,
na wo wasomdwe wo baby a obetna baby a utia asomdwe wo ho landlord bia metete wo baby a na landlord bia wo kwan na kamodia na just say wo apomudi.
Okay,
na apomudi no so any ye die your health is your wealth. Sana me bonito.
Yeah, wow, your health is your wealth.
Health is your wealth.
Number 2 ye ka se obi eni apomudin a bacho eno so obe chire mu sei
obi a oni apomudin obi a Unia Sumji. Ubia or how I want to be brave. Ubia either say ni hukafo ni yiri ana ni kuno ana ni ma asetena mo enye okay. Yes, enye okay ni just say tawatawa kasakasa just say ntokani asumdwe enifie.
Okay.
Papo enye odi. Because send enye akopo bo ni pano. We Bible no ma. Proverbs chapter 17 verse 22. Okay, say good health. I say a merry heart is like medicine, but a broken spirit dries up the bones. A merry heart is like medicine, but a broken spirit dries up the bones.
Doc, sorry, me try one say me busa sa question we because ye mu bi wo ho no ma ye nam ho we are looking okay but ye yare.
Yes. Wani pa bebre nam ho ye yare o.
Yes.
Intina e wo ma batisa asmasi bisa na ze oh yesu oko. So yes si na me ho no. Ti ase so no ti ase. Intini nyina kan se na nyakopo bo ni badua no. He made it in such a way that our wealth should be tantamount to our health.
Okay.
Because who was Mujia, who are Pomodin. Because we do what Sikano Buho Bebre, but Napomodino in Niho. Eduanicra and your day. Eduanicra and your day. It is sending a couple boss and American. Yes, some J. Send your Betty body, nasty body, now a crying or a fiddy. And like your car, you listen to your car and you know when your car has a problem. So it's the same thing I want to advise people. Say we are out here and say, let's listen to the car we are driving.
Okay.
Nobody know your private car. To send your private car, no sabe and necessary your body. So when you wake up in the morning, usually in your car, you check your car, you clean your car, you check your water level, you check your engine oil. But how many of us even check to see whether we have all of this before we start our day?
Yes.
Now, answer now, all of that. Yeah, our morning health depends on what happened yesterday.
Okay.
Your yesterday determines who you are today or who you will be tomorrow. And all is inclusive of how much stress you were able to manage during the day, how much water are you able to drink during the day, how much food are you able to eat, what time, and how you even eat the food. It accounts to your good health.
Wow.
And then on top of it, at the end of it all, what time you are sleeping.
That one too?
Yes.
Oh, okay.
What time you are sleeping.
Wow.
And what number of hours you are sleeping during the night. It accounts to our well-being.
Wow. This is very strange. Yemubi ohon we think say me sorry anopa na me didi 7. Oh, ochina ebia me sorry anopa na bibinti makwa ko didi be 11. The next day we okra bibinti etimbo be 2. But meanwhile as dog is advising no I call a car. Oh sorry, yes, I want for a full woman count to mean to.
Car.
But don't Yamia body mono. I don't know Yamian and say on a car if there is no fool. Or start your any so. Nanka was so yes how.
So it's like that. My ask one day. Because when you get up in the morning, once your eyes are open, it's like you are starting your computer. Your DNA is the computer, it's like operating system.
Okay.
It's like the DNA. To a little two in the morning now. Immediately what happens is your heart is always beating. It's always beating throughout the night. Sorry, then all the organs begin to be active.
Okay.
Now active, moja no a baby because the brain now becomes active and you are ready to move out of bed from the sleep mode to active mode.
Active mode. Wow.
The sleep mode from active mode. moja no a flow ko baby organs bia. So wherever your blood is not able to flow freely, you feel pain at that part of the body.
Okay.
So somebody will get up in the morning and say, my hand is paining me, or my leg is paining me, or my ear is paining me. It means at the setup, British system setup, blood is not able to circulate to that part enough.
Before I say, Madame Consul, you can't even turn your neck. Okay.
Wow. So when you sleep on when blood is not able to circulate properly to that part of the organ, the complaint the organ will make is the pain we feel. As human beings.
Wow. Wow.
So it's very, very important. And I say again that the quality of our sleep accounts to how good health we have throughout the day and the rest of the days ahead.
Wow. Wow. If you just join us, you are watching us live on CRF Television, live on YouTube. You are also listening to us live from CRF Radio, and we are transmitting live from Adenta Frafraha CRF Smart Clinic building. And away. But your minute Dr. Danso, opening Kessia or the CRF Smart Clinic, and they didn't come off here. Yes, we are there, just some little tips here, dog. You move baby anymore. You move baby, you name. And you best you had the dog, but you had the before a mema prostrate. I've seen a lot of recent concerns and incommodity be about mema prostrate. But though, can you believe, say, young guys no more banner to imagine because we think, say, prostrate is for the elderly one. But that romance, say, can say, prostrate, a debe chronic prostrate na, yale, and I say, yade, debe any prostrate. Make a bit of it if you not been one because Bofuna make an one tear say, yes, but you can say prostrate, yale, and I debe.
So the prostrate is an organ. Having a shape like a bean or an almond shape, like a bean shape, and sits at the bottom of the urinary bladder.
Okay.
Now, in this organ, there is a sewage system or a pipe that is connected from our kidneys through the urinary bladder and passes through the prostate gland to come out, to dislodge fluid, bad fluid from the body. Now, mostly, the way it's interpreted to men, I think it's misinterpreted.
Yes.
Because you hear somebody come to the clinic and say, doctor say, prostate enlargement, prostate cancer. Then I say, so I ask, are you urinating blood? The person says no. No. But I have prostate cancer.
Wow.
So what I think that we have not been we have not been carrying the information
the education
to make people understand.
What
so
that
let me break it down.
Okay.
So the prostate, like I'm saying, I want to liken it to the road that leads from Legon to Dodowa.
Dodowa, all right.
So from Legon to Dodowa, you come through Medina, which is the Zongo Junction. So I'll use Zongo Junction as a prostate gland. Now, when you get to Zongo Junction, there are tennis, left, right, and then there's one straight of you. So there is that T junction that goes here and there. Some goes to Medina inside, the other side goes to the Medina. The straight one carries on. The urethra, which is connected from the kidneys, from our kidneys. Is the road that passes through from Legon that is going to Dodowa.
The passage.
The passage.
Yeah.
So what can happen is, like, recently we have problem with the rain, with what do you call it?
The flood.
The flood.
Yeah.
See, when the flood is heavy, you can carry anything away. But when the flood pressure reduces, you see substance and objects settling on the road. So let me liken the prostate gland to be the road that is going through when you get to Medina or Adenta Junction. When you turn on the Dodowa road to go to Dodowa, you see that they are doing new construction.
Yes.
So the road is kind of rough.
Yes.
So motorists reduce their speed to drive on that road. the speed you used to drive from Legon to get through to Medina to get to this junction I'm talking about, you can never use the same speed to go through to.
Definitely, here is a rough road, so you have to slow down.
Yes. So the same way, when the urethra from the kidneys, urine is passing through, and the speed reduces from the bladder through the urethra to come out, the junctions, which is where the prostate gland is. In the prostate gland, I would liken it to be a town which have different houses. In the prostate gland, we have the testosterone, we have the seminal vesicle, we have the erectile transmitter, we have the sperm duct, and we have the prostate
all
gland.
these are in the human system?
They are all in the prostate gland.
Wow.
And these are the constituents of the prostate gland.
Wow.
So usually what I get confused about is when somebody is not able to pass urine freely, then we put the blame on the prostate gland. The prostate gland has nothing to do with the flow of urine. What may account for prostate effect is that the road that passes through, if there are obstacles on the road, it can affect the free flow of the urine. And that is why when there are infections in the urine that is coming from the kidneys through to come out into the waste, they can pass through because the juice that is produced in the men in the prostate gland, sperm that is produced as taste. So bacteria are attracted, and some of them miss their way and find their way into there. So for me, and for biologically how it works, the only way you can put the blame on the prostate gland is when the man is having erectile dysfunction. You cannot erect. You erect anyway, but you cannot sustain the erection for the minimum or maximum period you have to play the match. Or you can erect, but it is not hard enough, strong enough to be able to face what you have to face. Or sometimes you ejaculate, but you are not able to release the semen.
Because of the blockages?
No, not because of the blockages, but infections can affect the vesicles. It can affect the transistors that controls how sperm is released, how ejaculation is sustained, how blood is sustained in the ejaculatory duct or erectile transmitter to be able to sustain the erection for the period the game has to travel. This is the only way you can blame whatever, they can blame it on the prostate. But anything regarding urine, I think it is the urethra that is responsible. That should be blamed. Because when you see a doctor put a catheter in a man, the catheter doesn't end up in the prostate gland. It goes deep into the urinary bladder. You understand? It goes deep into the urinary bladder. And that is where the urine can be connected to come through the pipe, which is the catheter that is put to come out as urine. So men have not been, we have not communicated properly to men. And if you want to look at it holistically, there are 3 stages that can account for prostate issues. We have the benign, which is the enlargement, which is what we call the enlargement. Then we have the inflammation stage before we get to the cancerous stage. The first one is where infections impaired the urethra. So when the infections have impaired the urethra, there's kind of inflammation. So the urethra, the wall of the urethra inflames, kind of becomes tender. So it slightly thickens up. So it reduces the diameter the urine will pass through. And oftentimes when a man is experiencing this, during urination, he may feel some slight burning sensation in the urine.
As a washisho kakra.
Yes, as a washisho kakra. What to say, slight burning. That's what they call the benign prostate. There's some burning, some sensation in there. That is the first stage of something happening to the urethra. I don't say prostate, it's the urethra
that is responsible for
the
you to be able to urinate.
that is having the issue. when this road is not repaired, eventually becomes a bit inflamed. So you see somebody urinating, and because of the impairment, there may be difficulties. So the urine will not be able to flow all. The bladder will not be able to empty completely. So you find somebody, you urinate, when you pack, you see that some urine will still flow to wet your trousers or whatever you are wearing.
Yeah.
That's the second stage.
Okay.
So somebody urinate, you feel that urine is not, the bladder is not emptied. Then when it's not treated, when this is not treated, it gets to the third stage, where the walls of the urethra becomes or ruptures. When they rupture, then you see kind of blood droplets coming in. Sometimes you even urinate and you see blood. The urine is bloody.
That is when
where
it gets to that
cancerous stage.
Wow.
But I've seen a lot of people come to me, they say the doctor says I have prostate cancer when they are not even seeing blood, when they are even urinating freely. The other problem that are communicated to men, some men who have issues, that they say your PSA is high, or that is what they refer to as prostate enlargement.
Prostate enlargement.
PSA.
PSA.
It's a short for prostate specific antigen. The prostate specific antigen, if you look at the last one, antigen. The anti is the enemy that is fighting against the genes of the prostate gland, which is the semen that is produced, the sweet fluid that is produced, which is what is enticing the bacteria to get into there. So what it means is that multiplication of these antigens in the blood is what is read to mean prostate enlargement. So you see somebody having a prostate reading or prostate size of about 200. The doctor will say, well, they say my prostate is enlarged about 200, 250. It is not physical enlargement.
Okay.
It's the severity of the infection that causes the readings to go up high. Like somebody who have malaria and they say he has acute malaria, is read to be malaria plus. It's the number of pluses that determines how severe. So the figure, the size of the figure of the PSA determines how severe the infection is affecting the prostate or the urethra. This is even not the prostate, it's the urethra. That's the issue. The urethra, and I'm saying the urethra is the road that passes from the kidneys through the bladder, through the prostate gland to come out. That is where the problem is.
Wow. So there we are learning a lot here, and I wish we had more time because there's a lot of questions I would love to ask though. My next question is though, we say prostrate. Looking at my age and looking at somebody who is above 50, 60, 70, is our prostate the same? The size, is it the same?
The prostate size is the same. It never increases in size. Never enlarges like we are told prostate is enlarged. What happens is that the effectiveness of the prostate gland in a younger person is different from that of an elderly person age 60 and above. The person younger will erect and have longer erection period than somebody who is 60 years and above. Okay. Now, what also accounts for younger people also now having issues is, and it's not, well, I've seen younger people come to me and say, so one of the problems is infections from women, mostly is women. And that doesn't mean that women have been running from man to man. Women are most vulnerable to infections because of their makeup. Women have seen virgins who have infection in their, even their endometrium or their pelvis or their pelvic canal. And this is because of how they are exposed to public washrooms. Public washrooms is where most women unfortunately get these infections from. And another area is the kind of fabric, the underwears they use, the fabric of the panties or underwear that they use can also produce a lot of heat. So when you are in that, and there is what you do in the day requires a lot of walking. Okay. Then you can imagine the heat that will
myself is an example. I'm of that type that if I wear a boxer and it's not soft like this wool type, you see, they have these men boxers that are very soft. If I wear the hard ones, if I wear maybe from morning to evening like this, if I pull down my thigh, I can feel there's some heat rashes between my thighs. Yes. And sometimes if I keep wearing them for a period of time, it gets salt.
Yes.
In between my
Yes, that's what happens. Wow. And so this goes to women who uses unprescribed or nylon. You
see, look,
and very tight.
We lack a lot of education because as I'm sitting here, most of us we don't even know what we should wear and what we shouldn't wear. You should just know yourself.
No, you have to wear the cotton. Usually the cotton fabrics are better. So you get underwears that are about almost 100% cotton. That way you are better off. And this is especially for people who move a lot during the day. Okay. And then you also don't use one that is too tight on you. And then you don't have to also repeat them.
Okay. Wearing them at the same.
Both men and women. If you use it today, don't repeat it tomorrow. Okay. And then again,
boys, we like doing that thing. No. We wear boxers for like even 4 or 5 days.
No, you don't do that. You don't repeat it.
At times even a week.
No, you don't.
Because our own is when we smell it and it doesn't smell bad, then that means it's still good to use.
No, you don't repeat your. If you want to have good prostate health or prostate health, don't repeat your underwears. And women too, if you want to have a good hygiene down there, don't repeat
wearing underwears. Wow, it's been a great having doctor here in the studios, and we are learning about men's prostrate because we hear a lot of information today. Prostrate this, tomorrow prostrate that. Meanwhile, prostrate is sitting somewhere. It has nothing to do with the way you urinate. We are learning a lot today. In fact, Dr. Danso is here in the house, and we are still live on CRF TV. You are listening to us live on CRF Radio, transmitted live from Adenta Frafraha, CRF Smart Clinic building, and Dr. Danso himself is here. We were to host him for 25 minutes, but I think we've still about 3 minutes to go. But Doc, my very last question, and I know definitely I'm praying this week I'll get you here in the studio again so we can have a little bit discussion about these same topics again, because I know those who are going to watch this video are going to send in their comments. And yes, if you are watching the video on YouTube, please do subscribe, like, and leave your comments. If you're having any health issue, if you're having any health related issues that you want to ask Doc is always available to answer. Kindly do like, comment, subscribe, and share for someone to also get some of the video to share of such great education. I once heard that if you don't have prostate, you cannot give birth, being either you young or old. Boys, we used to run from whenever we hear, hey, you see prostate cancer, now boys see Johnny, you say, where they penny for yale. Though, is it really true, say prostate, penny for yale?
No, now no.
Now no.
Now no. It used to be. Elderly people's problem, but now a lot of promiscuity in the world. So even younger people are having it more than the elderly people. But it is really not the prostate that produces the sperm. It's the scrotum, the testicles. They are the ones that produces. And like I mentioned, the towns that are in the prostate,
okay,
the seminal vesicle.
Okay, they are all habitants of the.
Yes.
Okay.
There are towns in the city, the prostate city.
They are all living inside the prostate city.
They all have their role to play.
Okay.
The testicles produces the sperms and then passes it through the seminal vesicle. So if you look at the anatomy of the prostate gland, you see they all have vessels and where they pass.
Okay.
And then there is a canal, there's a blockage that it's like a covering.
Okay.
That when the urine will come, that's how God made it.
Okay.
It blocks the urethra so that it gives way for fluid, sperm to come out.
Wow.
When the urine wants to come, it blocks the sperm duct.
Wow.
That's what they call the sperm
Wow.
count.
God is
that
wonderful.
urine can come freely. So the problem is that infection, and I said infection from mostly sexually related infections can cause similar or sperm quality.
Some of these STI and
Yes,
STDs.
sexually transmitted diseases. Then the other thing that we don't even talk about, most health professionals don't talk about it, hormonal imbalance.
Okay.
Hormonal imbalance is one big problem where a man will have low sperm count. And then women will also have poor quality of egg.
This is CRF Radio.
And maybe at the next time when we get the opportunity,
Definitely discuss all those
we will
ones.
look at how hormonal imbalance affect fertility in both men and women. Because it's a huge problem that is not talked about. So at another time, because it's a whole chapter, if we open it now.
This is CRF Radio.
But Doc, let me quickly ask this question. Does women also have prostate?
No, women don't have prostate. Women have pelvic floor.
Pelvic floor.
Pelvic floor.
Okay.
And women problem can come during childbirth.
Okay.
This is CRF Radio.
So some of them can have the problem during childbirth, either and usually it's through normal birth.
Okay.
Something can go wrong.
Okay.
And they can have problems or prolapse. The pelvis will prolapse.
Wow.
So and they don't actually feel it earlier, but in their later years, they have what is known as prolapse bladder.
Wow.
So when prolapse bladder means the woman who, when she feels the urge to urinate, if she doesn't hurry up, the urine she will swallow herself.
Wow.
That's where we
Wow.
have prolapse
Wow.
bladder.
So, Doc, lastly, before I leave you to go, what would be your advice to people whom didn't have this information? You see, sometimes with the boys, when you're having a small urinary problem, you think it's prostate. Today, Doc has made it clear that if you're having urinary, you are not seeing blood, your urinary is flowing and everything. It has nothing to do with the prostate, but rather the urethra. So, Doc, what would be your advice also to somebody who's also experiencing some of the symptoms of the prostate, maybe having challenges and other things? The earlier symptoms that you are supposed to know. Nyama bi abeda di ntama mahu say ade we yi no ho de we dey prostate ntie bia ma menye say ansa na menko hu doctor. What would be the advice?
Okay, so the advice is will be my recap. That
This is CRF Radio.
what is often talked about, but mostly it is not what is to be blamed. It's the urethra that is supposed to be blamed.
Okay.
And the basic precautions or precautionary measures to take is any man, if you have the urge to urinate, please don't hold it up. Release it, let it go.
Okay.
And especially drivers, those who drive, who sit long and
Travel long
drives,
distance from
please,
Accra to Tamale.
yes, when you
long
have
journey
the
distance.
urge, don't say you keep it to get to your destination.
Once you feel
Please
it,
stop
please let it out.
and dislodge it for your own safety.
Okay.
The other thing is people should try and not to have multiple partners.
Okay. Stay with a single
Stay with
faithful
the person you
partner.
have. Let's all behave like the eagle. The eagle is very faithful to one partner. So let's all be faithful to one partner. And then we drink a lot of water.
Okay.
Some people say, I'm drinking water, I'm urinating more because I'm drinking water. That is not the issue. Drink more water. And if you are drinking more water and you are urinating more, it will stop over time when the system is able to cleanse.
Okay.
The kidney cleanses all the filth from the system. The frequency will be minimal.
Okay.
And then the last thing is about when you are having these conditions, please go to a doctor. Talk to a doctor. And when you go, please ask questions. Don't just accept whatever the doctor says.
Okay.
Ask the doctor questions.
Okay.
If they say it's a prostate, please engage the doctor and ask what is exactly that is happening. And pay attention. Let's also all men pay attention to themselves.
Okay.
And the attention I want you to focus on is there pain as the urine is coming? Is the urine coming freely or it delays to start? Or when you are done urinating, do you feel the bladder is not emptied? These are some of the symptoms that you should pay attention to and to complain. And when you are seeing these symptoms, It is not the prostate problem.
This is CRF Radio.
Urethral problem. When the urine doesn't start on time.
Okay.
When the urine, after urinating, you feel the bladder is not emptied. When you are feeling burning sensations as you urinate, it's not the prostate, it's the root.
Okay.
The urethra.
The urethra.
Yes.
That is where the problem is coming
Yes.
from.
So when you go, you have a challenge like this, please don't keep it. Don't go to the drugstore and buy medications for yourself. Talk to a doctor, ask questions, and ask the doctor the prescription they will give to you. How does it help or affect you before you begin to start to take the prostate or any medication that suggests to solve your prostate problem.
Prostate. Okay. And one last thing, Doc. You know, some of us, we individuals, I don't know why, but at times we find it difficult to go to a hospital when we are having such challenges. We rather prefer to go by the roadside to any pharmacy and go and explain.
That's one problem we have, and why CRF we are doing what we are doing.
Okay.
Now our hospitals have become a no-go area. Some of the nurses, the way they even attend to patients, if you go there, you go and sit there the whole day. And if you say you are going to the hospital, then declare that whole day a holiday. Or you are sure, trust me, you're going to spend all the days at the hospital. And to avert all of this is why CRF is doing what we are doing. We have this smart clinic where we say you don't come to the clinic unless strictly by appointment. And we say that we don't want you to come and stay for more than an hour at the clinic. Then go back home. Now we are making it simpler to say that don't even come to the clinic. Call us. Let us have your DNA and rest in your homes. We will do the diagnosis and do the treatment. It will affect you in your house. And we will only give you prescription when it's necessary. And that prescription too can be delivered to you in your home by a dispatch rider.
That's a plus.
So the problem is the challenges we face at the hospitals is why people
don't like going to hospital.
They want to go to the drugstore and go and describe how they feel. The drugstores do their there because they are set up.
At times you might go, you are feeling headache, but maybe the problem is not even coming from the head.
Yes. Okay. But the pharmacists.
Once you tell him you're having a headache, definitely
give you prescriptions for symptoms, and that is what is going on.
Wow, Doc, it's been very great having you today on the show.
Thank you.
We've stood most of your time, but we're praying within this week we'll have you once again before by weekends.
I will try.
Thank you very much. It's been a great pleasure having you. Thank you very much for doing the monitoring. I was with Dr. Danso, and I'll be back again with Dr. Danso within this week. So stay logged in on CRF TV, CRF Radio. We are here to serve you. When it comes to health, whatever that you need to know concerning your health, please stay tuned to CRF. My name is Michelle Bates. You can always call me DJ Fresh, and I am your host. Dr. Danso was our guest today, the chief himself of CRF Smart Clinic. CRF, we won't let you come and sit here and wait for an hour, just as Doc said. Nah, you sit at your homes. Wow, this is a plus, Doc. Wow. So God willing, catch you another time on CRF TV, on CRF Radio. My name is Michelle Bates. You can always call me DJ Fresh, and it was a health talk show with Dr. Danso, our very own. We'll be back again some other time. Stay tuned, stay blessed. Bye.